Thank you. Good evening, Rare Disease Day participants. My name is Jonathan Pinto, and I'm co-founder and CEO of Rhythmm.Ai, where we are engineering the future of prior authorization. So how many of us, and we do have loved ones as well, that have, let's say, got a skin irritation, and you decide, I need to go see my doctor. You go to your doctor, and the doctor says, I hope that's not cancerous, so we're going to do a little procedure. But wait, we have to get permission from your insurance company first before we can do this. This process is called prior authorization, and it's a broken system where more than 94% of physicians are trying to put this puzzle piece together. And they say more than 94% of physicians say delayed prior auth leads to adverse outcomes, and sometimes even potentially life-threatening, especially in rare disease states, where the average turnaround days is 9 days. For this process, it gets exacerbated with rare disease to as much as 25 days. And 14.6 hours is wasted per physician and their staff in dealing with appeals, denials, and eventual burnout. But fret not, Rhythmm.Ai is here. And we are the connective tissue connecting physicians, the payers, the plan sponsors, and the patients together on our AI platform that instantly reviews and communicates these prior auths. For physicians, we're that tissue where we are connected into the medical care guidelines, and we can tell you, instead of throwing spaghetti at a wall to see what sticks, what the payer is expecting. Or on the payer side, we are connected to all their plan documents, their payment rules, that when you submit a prior auth, we can say, hey, this is now approved, and what is the right language to avoid that more than 70% of rare disease prior auths that end in a denial or appeal. And of course, to say, we take all of this from days into minutes, steering for low outcomes, and best of all, championing the business of healing. We're solving for three things: speed, cost, and accuracy, where we take that 9 days and do it inside of 9 minutes, saving over $19.23 per prior auth, and eliminating over 99.5% of false negatives where care should have been approved for a patient. We have already been in market since May 2024, generating revenue with physicians and health plans all over the United States who are serving patients that are connected to Blue Cross, United, Cigna, Aetna, among others. Our team at Rhythmm.Ai has over 40 years of combined care experience, and we have 3 exits under our belt, and we are prepared for all the new regulations that are coming down in January 2026. So why don't you join us in accelerating the rare disease patients' access to care with instant prior auths with Rhythmm.Ai.
This is a huge issue I know a lot of parents in this room deal with, and physicians. So it's exciting to see. So who's paying for it? You said you already have revenue generated, and a secondary to that would be, how many people have used this to go from 9 days to 9 minutes? Like, what, if you give us a little more context there.
So the payers are paying for it right now. The payers are paying for our platform right now because they typically outsource this to third parties to do the prior authorization. However, physicians are also paying for us to avoid and have us deal with that prior authorization. So there is a big benefit to them to get that approval the first time around. Today, we have over 8,000 lives that are already on our platform, and we're going to hit about 28,000 year by late fall.
Yeah, is your plan to stay back office with most of your services, or do you plan to also take care of front office services? What's kind of the overall roadmap of the company as you grow?
So right now, we are all not just the technology, but also the service model. So we are taking over prior authorizations where the payers using our platform, but our nurse case managers are also working both with the physician's office to actually on their delegated authority to get those approvals done as well. And then on the physician side, we're augmenting the prior auths teams, or with a lot of independent physicians, they don't even have the teams to do it, so they outsource us and we help them do that entire process.
Thank you.